I'm Daniel Stein with Stewards of Change and the National Interoperability Collaborative. I'm really delighted to welcome you all here today to the West Sacramento Civic Center Galleria. For those of you who made it, I appreciate that. We're going to start off this morning with just introductions. I'm going to invite Mike Wilkening to come up and say a few words, and then we'll work through the introductions here this morning.
Great. Thank you, Daniel. And good morning, everybody. Maybe a little more coffee. Well, welcome to California. And as Daniel said, I'm Mike Wilkening. I'm Undersecretary of Health and Human Services for the state of California. And we're really happy to be hosting this first regional gathering of the National Interoperability Collaborative, and very happy to be part of the initial cohort of the NIC. So as many of you know, we've partnered with Stewards of Change over the last several years on the Open Data Fest that we've had here in California. And so the NIC builds on the lessons that we've learned through those interactions and provides a framework for us to really push forward interoperability efforts. But it's not merely linking data just for the sake of linking data. It's linking data together for purpose, to solve big problems, to figure out how to make things better for kids, how to address, issues like the opioid epidemic. And so I think that this gathering here and looking around, and we've been talking to some of the folks here, has the potential to really help us to figure out how to move these efforts forward, figure out what we're doing in various places, where it's successful, what the lessons have been learned, so that we don't have to continue to struggle over the same issues that somebody else has already solved, learn from each other's failures and successes. And so, I think settle in for a couple days that are going to be really exciting and fun and interactive. And any of you that have done a Stewards event before, you know that there's going to be a lot of exercises and a lot of opportunity to talk together and to learn from each other. So again, welcome to California, and really happy to be here with you.
Yeah, so I hope you brought your running shoes with you, because we do have a lot of activity here today. And we've designed the agenda, as you have in front of you, to both be a mixture of content delivery and then also your opportunity to sort of weigh in on it and talk with colleagues. We've arranged tables here today to sort of mix it up, so go against the tendency of people sitting at their own tables with the people that they know to get the conversation going. As Mike said, this is a conference in a series that we've done over the years here in California, working on information sharing, integration, interoperability, and we're really delighted to be able to come back. The NIC, the National Interoperability Collaborative, really is an outgrowth of the work that's been going on for the last decade plus, I would say, both in California and across the country, to bring organizations together, people together, and people who are running programs together to really learn from one another in various ways. And as we all know, it's a hard thing to do. It's not an easy task, but we're excited about the momentum and the direction that we see happening across the country. And many of the people in this room are at the vanguard of that in California. And as you see from the attendee list that you have there as well, there are folks from other parts of the country as well who are both part of national associations and other program offices that are doing related things. We are really committed to this idea of building a national collaborative and the opportunity to connect people across the country and potentially even beyond that who are doing related things so we can learn from one another. I think one of the lessons learned we've had over the years has been that there's a lot of duplication and repetition going on without necessarily a means or a mechanism to share that information. So we got started on this work, well, we've been doing it for a while, but about a year and a half ago, we received a grant from the Kresge Foundation to actually build and stand up this collaboration, which we are about a year into, and we're delighted to be able to really bring it out here. We really launched it last summer at our national event at Johns Hopkins, and it's really been able to accelerate the efforts here a lot. So I imagine there's a number of people here who are maybe somewhat familiar with the NIC, or the National Interoperability Collaborative. So what I'd like to do is just spend a couple minutes showing you a video of the NIC, and that'll give you a good sense of it. and then we'll proceed forward here.
The National Interoperability Collaborative, or NIC, is a new initiative designed to increase collaboration among the sectors that impact education, health, safety, and well-being by improving information sharing, interoperability, and the use of technology. Stewards of Change Institute and AcademyHealth, with generous grant funding from the Kresge Foundation, are working together to create a NIC community of networks that brings broad benefits, particularly for at-risk and underserved members of society.
We think that the National Interoperability Collaborative can play a unique role by connecting across sectors, across programs, in ways that has not really been fulfilled before. The idea is to bring together the various networks that are out there doing related work to link the various initiatives and actions and efforts that are going on that really will help multiply and advance the work.
NIC will build on existing networks using our innovative approach to advancing interoperability. The National Interoperability Collaborative will convene key stakeholders, identify best practices, provide case studies and technical assistance, offer the interoperability training curriculum and certification program, and disseminate information and recommendations.
The National Interoperability Collaborative is a tremendous and audacious push forward to really take interoperability from, at least the way that I see it, from where it's been to where it really needs to be.
The NIC also aligns quite well with ACF's efforts to support interoperability in human services at all levels of government, and I see strong alignments between the NIC and ACF's interoperability efforts.
Stakeholders across all sectors and across all levels are trying to figure out how to really understand the determinants of health. So then interoperability becomes really important, crucial really.
One of NIC's distinguishing characteristics is its focus on cross-sector collaboration and learning across 6 domains.
I have people in my court who are sent to behavioral health, they're sent to school, they're sent to all these places. I can't share information with Indiana, which is 30 minutes away from me. NIC will give us hopefully the standards and then come together to more efficiently save money, but really help families and children.
Participants are integral parts of the NIC community. The value of involvement is being on the front lines of accelerating progress to get further, faster. Sharing your own experiences and expertise can help us capture best practices and to better serve at-risk populations.
The need for us to recognize the power of interoperability is here. We want to be able to bring the chance that social services and health and the social determinants of health are all coming together in a time that we'd only hoped for.
How can you get involved? Visit nic-us.org to learn more.
So a picture is worth 1,000 words, so that must be maybe 1,000,000 words up there that is worth, but hopefully you get a better sense of it. Succinctly, also, we created this so that it's something that you can share more broadly. We see you really as the vanguard of the NIC. You've been invited to participate in this and help create it. It's a entity in the process of being created, and we really invite you to participate in that over the next couple of days, to help shape it, help form it, and ideally, at the end of the event today, and as we go forward, participate in actually crafting this work and crafting the NIC to meet your needs in particular, but also serve the rest of the state and hopefully the rest of the country. That's really the intention here. The idea behind the 6 domains, as we referred to it, came from some work we did with the Healthcare Information Management Systems in Society, or HIMSS, a year and a half ago, to really look at what's going on with social determinants, how can healthcare integrate with more broadly with public health, and as we began to discover that, one of the things we thought about was the 6 domains. We discovered that in part of the research. And what was interesting was the interconnections between them. There's a lot of overlapping interests, and one of the things we've done, and in your materials here, is a short overview of those 6 domains. We offer that up as a way to introduce you to those different domains, and we're in just a moment when we get into the interactive exercise, we'll actually call on you to think about what you know about those things. How well are you versed in whether or not it's public health or education or healthcare or emergency medical services, because there's a lot of overlap and there's a lot of interaction between all of those services. And I think we come at this work from a very limited perspective from our own domains. one of the things we're hoping to do is really expand that out. As we got started on this work, very briefly, there are a number of partners who were the original folks in the grant. So California Health and Human Services Agency, the state of Connecticut, Department of Social Services, and the Commonwealth of Virginia. And within each of those, we have also been identified, we've also identified our other partners, including the Silicon Valley Regional Data Trust, who you'll hear from a little later this morning. Very exciting work going on there. And then in Connecticut, there's a new project that's getting launched there. It's called the Bridgeport Prosperous Cradle to Career. We'll hear about that a little bit more tomorrow. And there's some development work going on in the Commonwealth of Virginia. And we have the former secretary, Bill Hazel, who's here to help us understand what's going on with both Virginia and more broadly. And then HIMSS is one of our other partners. So I also want to recognize and acknowledge our sponsors who, as I said, the Kresge Foundation was one of our, the funding, the underwriter of it, Microsoft Corporation, IBM Corporation, and also NIC are sponsors that have allowed us to help build and expand this work going forward. One of the things we've done with the startup of the website, which is now live, I don't know if many of you have visited yet, it just really went live just a couple of days ago. It really explains all this and provides a forum for that. We have some initial organizational members. Those are essentially groups that have said, yeah, we understand this mission, we're behind it, we're supportive of participating in this work as we go forward. And that's been a real testament to the interest that goes from social services, to public health, to healthcare IT, to a whole variety of different academic institutions and providers. So this speaks to me in a very powerful way of saying that we're tapping into something that's of great interest across multiple domains and across multiple sectors. As we've gone out over the last 6, 8, 9 months and really talked with people, we find that there's a real palpable interest and a need to really connect in ways that have not really been accessible before that. So what will we do? It's said in the video, we want to convene and facilitate and activate stakeholders. We want to bring this group of people together and expand that to be involved both personally and virtually in a community. We're building a portal and a hub, which we'll hear more about tomorrow, and want your help designing that and working on that. We're publishing findings and recommendations from scans and research around integration and interoperability and data sharing. And we're preparing some case studies that will be hopefully helpful for you from a teaching and learning perspective. And we're also developing an education training program. This is complicated work when you start crossing domains and silos, and how people can think laterally is not something that comes naturally. So we're developing a curriculum that will help people both at all levels, virtually at all levels within an organization, really understand the concepts and provide a language and vocabulary for that. And again, we'll show a little bit more of that tomorrow because we think that in order to do this work, we need a more informed, more competent workforce who really understands integration and interoperability in a big way. And then we like to think about ourselves as sort of strategic worrying. So what can we learn from successes and what can we learn from things that were not successes, that were failures? As we talk about this, oftentimes we hear people really talk a lot about what things that didn't work and what we can learn from them so we don't repeat those mistakes. So we're hopefully providing some of that support. Again, we'll talk a little bit more about this tomorrow, about how you can get involved. We're just standing up an online community, a collaboration portal. We want to engage you in those conversations. Some of you who participated in the LinkedIn group was just a little taste of that to get us online a little bit in advance to be able to share information. We'd like to invite you to join as a member or partner or sponsor. There's various ways to do that. And then to identify your interests and passions. What do you want to be involved with? As I said, the portal and the collaboration portal is something that we're looking for, hopefully at the end of this meeting, the people who will stand up and say, I'm interested in this. I want to help design. I want to help curate it. I want to help steward this work going forward and facilitate those conversations across those domains, which is really important work. Without going into the details of the agenda, which you have in front of you, it is, again, a combination of presentation of some materials, a chance to talk about them back and forth. Today we have Secretary Dooley will arrive for lunch and have some words to talk about from the state's perspective. We'll talk a little bit about the opioid initiative, and then really dive into another interactive session, and then some innovative solutions in California and beyond. Tomorrow at lunchtime, we're going to have affinity table lunches, which is just an opportunity for you to have more opportunity to get into conversation around topics that we've talked about today and some other topics, and those sign-up sheets are by registration. So it's not mandatory, it's an optional opportunity for you to get into that conversation with your colleagues and friends, or enjoy the sunshine outside. So if you just take a moment sometime during the break or lunch or whatever and just sign up so we can sort of arrange the tables, that would be very, very helpful. And I think we found in the past that work to be very exciting. And so with that, I'm going to hold my remarks for the moment and ask Margo to come and say a few things.
Thank you, Daniel. Good morning, everyone. We're really, come on, a little more coffee. You've had a little more coffee since Mike welcomed you a few minutes ago. We're really pleased to be here. It's nice to see so many people in person that I've spoken to over the months by phone, and we're just thrilled to be here in beautiful Sacramento on a sunny day to talk about some really important work and fun that we hope to have over the next couple days and the coming months. I'd like to start by just telling you, for those of you who are not familiar, what AcademyHealth is about and why we're so excited about this partnership with Stewards of Change. We met Daniel about 3 years ago. We started going to Stewards meeting some of you, and I think people said somebody ought to, put together something like this collaborative. And with the support of the Kresge Foundation and the other folks you've heard about, we were able to launch about a year ago a partnership that has really stretched our team and really helped us do some things that we care about a lot with the help and support of a lot of you folks in the room. AcademyHealth is a national membership organization that has individual members, corporate members, academic members, interest groups. We have about 4,500 individual members and about 200 organizational members, and we work to build evidence about what's happening in the health and healthcare space and to move that evidence into practice and policy. So we have about 60% of our budget is related to working with federal partners like the Office of the National Coordinator, CMS. We hope to be working with ACF and some of the human services agencies in the future. ARC has been a supporter, the Agency for Healthcare Research and Quality has been a supporter of a lot of our work about collaboration in the healthcare space. We also have had support from private foundations, including the Kresge Foundation, the Robert Wood Johnson Foundation, California Healthcare Foundation, and others who are represented here. So what we like best, I think, is to get out into the real world and talk to people. And one of the things we're going to be doing here is to be presenting some results of a scan that we did of interoperability guidance across the domains or sectors that you've heard and will hear a lot more about. What's happening in the healthcare space and public health? Education has some really good interoperability guidance. We will be telling you what we found, and we'll be asking you to help us fill in some of the gaps for the guidance that hasn't been written yet that really needs to focus on, for example, the trust fabric, or some of the how-to working with social media, or how to build social support. So this will be a very concrete planning organization meeting. One of the reasons that we care so much about the work with the NIC is that when we started working with Daniel and his team, we realized that it's a community of communities. People in this room have known each other for a long time. They've watched each other's kids grow up. They have, there are friendships that have formed here that we think are really important, that form the basis for getting into some of this brave new territory about sharing information that people are not used to doing. So as we're building community, one of the things we want to do is find out who's in the room. We thought we would start there. We've already divided you up into groups according to your sectors, but we'd also like to find out where you're from. So show of hands if you're from the public sector. Okay, how many of you are from local government? I'll give you a moment to look around. I see local. Okay, state government? Okay, and we have a few people from national government. We have, okay, from the US and Canada. Yes, we're international. Industry, how many folks are from industry? academia, the nonprofit sector. How many of you are from foundations? Okay. And now I'm going to ask, so you see we've got a pretty wide variety here. Now we're going to ask what you do. So how many of you have a kind of a technical job, either maintaining a community or a CMIO or, okay, thank you. How many of you manage programs? Okay. How many of you do direct services? How many of you do research or analytics? Whoa. Yay. How many of you have the word innovation or interoperability in your title? Or it's what you do, or kind of how you... Cool. This is very cool. Okay. Thank you. So one of the things we want to do here is find out what values we share. Start there. What do we have in common? Then we're going to start looking at different models for collaboration. Daniel's already described some of the program. You're going to hear from people from all over the country. We're also going to really look at best practices. And since we have some guidance, and some guidance is formal and some is informal, some of it will develop through just the informal process of sharing information, but we also have some more structured best practices presentations, and I think that's my segue to turning over to Marcy. Thanks, everybody.
So are you properly caffeinated at this point? Good morning, everybody. Oh, that was great. Thank you. I'm Marcy Lauck, and I am one of the co-founders and co-directors of the Silicon Valley Regional Data Trust, and also the Director of Data Governance for the Santa Clara County Office of Education. I love looking around the room and seeing so many people I know and value as partners. I think there are many friends that I haven't met yet that I'm looking forward to meeting over these next couple of days. But I wanted to start out by saying that the Silicon Valley Regional Data Trust we're just proud to be one of the, kind of founding partners of the National Interoperability Collaborative, and working closely with Mike and his team at the California Department of Health and Human Services, and also co-sponsoring this event with Stewards. Our mission is really aligned to the NIC. And that is really to facilitate this sharing of data securely and confidentially across a broad sector of organizations to really improve outcomes for children and families. I've been in education my entire career. The group of us that started the trust actually had all retired. And we had this incredible opportunity, and Rod Ogawa will share more about that when we do our presentation a little bit later this morning. But we realized that we had this really unique opportunity to bring collective experience together from particularly starting in education, but really being able to understand that we really need to do better at serving our kids and families. And the way to do this is to build this kind of collaborative effort at how we share data across these different domains. So we're looking forward to not only sharing the story that has been evolving in our work over the last 5 years, but we're really looking forward to hearing from all of you because we know these efforts are happening everywhere in the country, and we can only get better at doing this by putting our hearts and minds together to this wheel and helping it turn. So looking forward to the work of these next couple of days, and thank you all for being here.